Good morning, everyone. I'm Dawn Ardula. I'm the CEO of the Livermore Valley Chamber of Commerce, and I'm here with my neighboring chamber CEOs for our second visit with Dr. Nicholas Moss, who is the Alameda County Public Health Department's Public Health Officer, who is overseeing and who is the authority on the COVID-19, regulations and requirements that govern what's going on in Alameda County. So we're really excited to have Dr. Moss join us again for a second time. I just want to real quick, couple things. We're going to have each of our chamber CEOs say hello quickly. Go ahead, Inga.
Hi, good morning, everybody. We're really excited to hear from Dr. Moss again, and thank you for tuning in.
Good morning, everyone. Steve Van Dorn, President Chamber. Welcome back, Dr. Moss, and thank you, Jody, for coordinating everything. Glad to be back again visiting with you.
Yes, and then producing today's webinar is Amos Productions, and we have Jody Amos here. And Jody, you have some instructions for the viewer.
Oh, yes. Just wanted to say we are going to leave the chat open, but if you have any questions for Dr. Moss, please put them in the Q&A so we can moderate them in one place. That's it.
Mm-hmm. So Dr. Moss is going to give us an update since we saw him on July 1st, which we had just entered into we had paused the reopening, and then we'll move into Q&A after that. All right, Dr. Moss, welcome.
Thank you, Don. Good morning, everyone. It's good to be back here. I think I can't even remember how long it's been. I think at least a month, and so happy to be joining this conversation again. I am going to share a few slides, but I think there's plenty of time today, and we'll be able to spend a lot of time on Q&A. I know there's some questions out there, so bear with me. This will be for some of you who like to look at the data. Are people able to see my slides?
I can see them.
Yes.
Yep.
Okay, great. Okay, so you know this part. This is our reported COVID cases by date. This goes back to May 1st, so not the very beginning, but it shows this big run up in cases in late June and July that really slowed our reopening plans, paused our reopening plans. The orange line is an average, try to smooth out the lumps and bumps. Just a few things to note. Some of you who read the COVID news may have heard there were issues with at the state with lab reports coming from laboratories to the state of California, and we actually rely on that data. The state then sends it to us at the local level. And so there's a few things to note about that. First is on the right side of the screen there where there's that dip in the orange line, and you can kind of make it out in the blue lines as well. That's actually, there's some missing data in there, and some of it appears later on in those last few days on the right-hand side, those big bumps. So, this needs to be interpreted with a little bit of caution. We think really what's going on is some of those cases are spread out through that dip, and it is probably more flat, although not dropping. And this issue is still kind of being worked out. We think there's still a handful of missing data from the state. So we're really interpreting everything with a bit of caution right now. This is the same data looked at another way. It's a 14-day cumulative case rate per 100,000 county residents. And what this shows is the rate of reported COVID diagnoses. And you can see we peaked at about 180 per 100,000. Again, that's 14-day cumulative. So you add up the cases per day over a 14-day period, then you divide by the county population, you do some other math, and you get this rate. So 180 per 100,000 in mid-July was our peak, and you can see we've dropped down from that. I will tell you that as the more data has come in, we're probably closer to about 115 right now, not 100. 100 is the state's data monitoring threshold. If you've heard that we're a monitoring county, we are, like most of the populous counties in California, and this 100 per 100,000 is one of the state's threshold to put you on the monitoring list. So we're still on that list as near as we can tell, But things do seem to have improved since mid-July. So cautiously optimistic about that. And then this is our hospitalization data. This is not subject to those lab reporting problems at the state. What you see in blue is our total people with confirmed COVID hospitalized by day, going back to the beginning of May. And you can see we had this big run up in hospitalizations in July as well, peaking at 213 people with confirmed COVID hospitalized in Alameda County on July 28th. We've dropped about 20% since then. I'd like to see it drop more. But this is a pretty accurate reflection of the burden of severe disease in Alameda County. In the orange line below, probably even more accurate is the number of people hospitalized in the intensive care unit with COVID. And again, it's a little less evident, but we rose up to the 50 to 60 range in July, and we've actually kind of stayed there. So we still have quite a bit of severe disease in the county, but what is good when I look at this is we've passed the peak, it seems, and things have stabilized. This is generally good news. I just don't think any discussion of Alameda County's COVID data is appropriate without highlighting again the race and ethnic disparities that we see with COVID. And so this very straightforward slide, it shows the proportion of our total reported COVID case by race ethnicity and compared with the share of county population by race ethnicity. And so the most glaring thing is that 60% of our cases are in Latinx residents, but they make up only 22% of the county population. Communities of color in general disproportionately impacted. We also see Latinx and Black residents hospitalized disproportionately compared to other races and ethnicities, and deaths, in particular with Black county residents, disproportionately high. So a lot of reasons for that. Among others, historical racism and also economic inequalities that result in people needing to work out of the house a little bit more, right? I get to work from home. A lot of people from these communities don't. And also living in more crowded households. COVID strategy for the county. I'm not going to spend too much time on this. I think what's most relevant for today is the shelter-in-place strategy and how we regulate reopening and the mixing of people. The more people mix, the more COVID we see spreading, the more cases. And that has really been balanced out by improved face covering use, improved physical distancing, which I think explains why things have stabilized over the summer. Because although we paused reopening, we didn't close anything back down. And so that's encouraging that people are doing a better job with the personal things they can do to prevent spread. We want to, of course, promote testing, case investigation, contact tracing. We invest a lot of resources in those areas, and supporting people who have COVID, particularly those who can't get unemployment benefits or can't get sick leave. There's some new things the county has put in place to support some of those folks, rental assistance, things like that. And then just coordinating an effective response, working with community partners such as yourselves to make sure that we're doing our best to balance our public health goals and actions with all the other concerns that play into this pandemic. So these are our indicators. We haven't really updated this slide in a few weeks because of the state data issues, but I think it's still accurate. We've improved a little bit on cases and hospitalizations, as I mentioned. I think our ability to do disease containment, contact tracing, case investigation interviews, helping people isolate and quarantine, that's improved a bit over the summer with more staffing. A long ways to go there. Testing remains good in terms of what we're trying to do at the county level. A lot of issues with some large commercial labs, some testing providers in terms of slow turnaround times. This has also been in the news. So that's really the one place where we're really hurting on testing, but it's a little bit outside of the county's control. Hospital capacity, I think we're in good shape overall. Personal protective equipment, it's a kind of a misleading indicator. People have enough to get through the day-to-day, but certainly ongoing supply issues. Okay, so I think we'll spend most of our time talking about reopening today, although we're certainly, I can speak to other issues with COVID and health. So we paused back on the 19th. Actually, we paused on the 29th, but it's we haven't opened anything since the 19th of June. We paused on the 29th of June. That's quite a while now. And I think that's given us a chance to let things settle down, decompress the hospitals a little bit. But I understand that's a burden for, particularly for, people who make up this group. We are now in planning to hopefully resume some cautious, safe reopening finally. And there are some sectors that I think many people on this call would agree with the right procedures in place, outdoor, things can be done. And so we are planning that now. I don't put dates on these, but we're talking about a pretty short timeline in terms of getting some things open. Schools is on there on the list of the next things to open, but that's a different timeline in terms of getting kids actually back to in-class learning. It's more there to show that it's a priority for us to plan and work with schools and other stakeholders to get what needs to be in place to get some level of in-class learning this school year. Schools, pretty much every other sector at this point pales in comparison to schools in terms of the complexity and number of people and the economic impacts, and of course the long-term health, mental health, and economic impacts on the children themselves. So it's just a huge sector that there are a lot of complexities to, but we are prioritizing it in terms of where we're looking to go from here. Just another thing that we've managed to staff up and are doing a pretty good job with, I'd say, is we have a better workplace team in place now. It was already in development when we last spoke, but much better now. So first of all, we address guidance, technical assistance on safe reopening, answering questions, connecting people to guidelines. We also have a team that monitors cases and clusters and workplaces, refers some of those to investigation by our investigators. For smaller clusters, we're really more about supporting employers to make sure they have all the right things in place in their workplace, the right next steps. Working on making sure employers know, what to expect when there's COVID in the workplace, when staff can come back, when they should stay home, that kind of thing. And I already mentioned the outbreak investigation aspect of it. One really important takeaway message from workplace safety that I want to leave you with, and I'm gonna, in fact, I'll wait until I finish my slides, but just a plug for our new data dashboard. The web URL is up there at the top of the slide. Our data folks put a lot of work in scrambling to improve the way we share data. I hope this is much more easy to navigate for you all and people in your communities. We continue to add to this, develop data. There's a lot up there, including some of the stuff that I shared today. It might look familiar. Needs work, needs more stuff. We're constantly working on it, but I think a big step forward. Also, we've cleaned up and tried to make it a little bit easier to navigate all of the guidance and shelter-in-place order stuff. I think some things that are of interest to this group. So on the same website, hopefully that's easier to navigate. I know it's still a lot. Okay, so that was my last slide. And let's see, I need to end the slideshow and I'm gonna stop sharing. And so, as we transition over, I want to also share one thing, and I probably mentioned this before, but it's the state and federal guidance, CDC guidance is much clearer now. Once people have tested positive for COVID, they don't need to be tested again. There's no role for repeat testing. if you have COVID, it's 10 days at home, 10 days from symptom onset before you can come back to work, but you don't need a test to come back. It's not useful information. It's stealing valuable testing resources from people who need to get tested for diagnosis purposes, right? We want to get those turnaround times down at labs. And so really, we are asking employers to not require, ask for clearance testing from employees who have COVID. And another thing, if somebody's in quarantine, a negative test doesn't get them back any sooner. So there's a time and a place for testing for people in quarantine. But for the most part, from an employer standpoint, we're asking you to let people come back to work when they've been out for 10 days if they're sick and or when their quarantine ends. So, so I just wanted to share that message because I think you are all in a position to help us make sure that as much testing is available for the people who really need it. That's my spiel.
All right, well, we do have several questions. We lost Dawn. I think she's logging back in here in a minute. But Steve, do you want to take some questions, or Inga?
Yeah, Inga, do you want to go through the Q&A first, and then I'll hit some of Dawn's questions that she sent to us until she comes back?
Okay, I'll start with the first two in the Q&A. They're kind of the same thing. They're both having to do with outdoor wedding venues. The first one asks, small wedding reception dinners are allowed at restaurants, but will venues be permitted to do the same thing? No dancing, just a small reception per county guidelines like a restaurant does. An intimate dinner and following the protocols with masks if worn when they're not seated at the table.
Yeah.
And then the other one, that's because they're kind of the same, so maybe hopefully you can get them both, is the Tri-Valley is home to a large number of event venues celebrating couples unions. If the venues with outdoor accommodations, do you see the opportunity of getting a variance for gatherings under 50, as the CDC has recommended for the next 8 weeks? So basically it's venues, can they start offering dinner outdoors?
Yeah, so at this time, no, we're not permitting dining, in those settings. And I think the concern is that it's much more complicated to regulate and make sure that things are happening safely in that setting. And we're concerned about people removing their face coverings in already what is one of the only situations where we're really allowing gatherings of any kind. And so I think in order to, keep, and I have to be honest, weddings and parties they just keep popping up as places where people get COVID. So I just don't think we're at a place yet where we feel like that can be regulated and done in a safe manner. I'm sure there are individual businesses who have the ability to do this right and do it safely. But I think the problem is from the standpoint of across the whole, industry, we just still feel like it's enough to be able to let people for these very unique circumstances get together in a group, but to then add dining and mass off to that is very concerning. Restaurants, very different. People should be in their household bubbles. It's very regulated. The restaurant rules are very clear. It's a small number of people. So I really think they're very different. And that's, of course, all of it should be outdoors. In terms of the numbers, yeah, we are looking at that. We know that 25 is a limitation. It's not a variance situation per se, but it's more where we set the threshold locally. And I appreciate bringing that up because I think it elevated, we saw the question in advance and it's elevated it for our policy team. And I am open to looking at that because I think, we want to try to be, we recognize that it's a small number. We want to be consistent with some other guidelines that are out there. We don't always do exactly what CDC says. They have to speak for the whole country. And so we can often be more restrictive here based on what's going on with our epidemic. But I think it's a good time for us to relook at that number. All the other things will still apply, distance, face coverings, that sort of thing. But thanks for raising it.
Steve, do you have a question?
Yeah, I'll ask the next question. This comes from David Kent, and it has to do with the outdoor wine tasting, and it's moving on me. This requirement does not improve safety, according to his comments here. It simply adds complexity and expense when Alameda County revises order to reflect this change.
This is I'm not sure I heard you say it, but this is about requiring that they serve food, right?
Yeah, correct. Sorry.
Yeah.
While
Yeah.
they're tasting wine. Yeah.
Yeah, I think, again, we're preparing to do some reopenings, and I am expecting to move to consistency with what the state guidelines say, which for wineries, which is different from breweries, brew pubs, and bars, that they can be open and they can do it without food. So we are looking to likely make that change with the next order if things are continue to look stable. So I'm glad to say that we can see the rationale for removing that restriction from outdoor tastings for wineries. So that's where we are. It's not done yet, so that doesn't mean this weekend you can pack it all up. But I hope that's seen as good news from some people in the Tri-Valley area.
Yes.
Okay, the next question is raised by a police officer. I think LARPD. That's I believe.
No, that's the rec center.
The rec.
Yeah,
Okay,
yeah.
the rec center.
Rec center.
Sorry. Anyway, he's asking about the personal toll the pandemic is taking on health officers and other healthcare workers, and their threats to them, lack of support from higher ups. Is there any support for them?
Well, I think it's I'm going to separate health officers and healthcare workers because I have the good fortune to be able to work from an office or the nursery, and I'm not actually working on the front lines in emergency rooms and patient care rooms where you cannot distance, because the work means you need to be close to your colleagues, you need to be close to the patient, you have to wear those respirators, you have to take them on and off carefully. You're working 12-hour shifts, and so that's a kind of stress that I certainly experienced personally in my work career, but I'm not doing that right now. It's different challenges for health officers, but I just want to note that work is extremely difficult in a situation of a pandemic where people are concerned for their own safety, their families, and yet they are fulfilling their obligation to serve as healthcare providers. For health officers, it's different. I've been fortunate, so I've been in this role since about July 1st. My predecessor, Dr. Pan, moved on to the state, and now she's actually interim state health officer. I think there have been challenges in Alameda County, but not to the degree of some of what you may have seen or heard about in the news from other jurisdictions. I know it certainly played zero factor in Erica's departure. I think she had a great opportunity at the state to really, lead in the response and be a leader in public health. My own experience has been, by and large, one of feeling supported by both community members and by the leadership, including the elected leadership in the county and across the region. And so, I think we're in a good place in Alameda County where I feel like I can make decisions based on health, and that the leadership will stand by those. I think it has been a challenge for others in other places, and I know that this is an area that a lot of people are aware of and are concerned about. And my experience is that even outside of the county, the vast majority of people support what public health officials are trying to do with the pandemic and keep everybody safe in very difficult circumstances. And it's unfortunate that some people have had, just with in very limited ways, some substantial difficulties. And I'm hopeful that that's a phase that we move through, and that as we're sort of in a position of trying to get things back open, some of that will recede. I do have concerns for the winter, and if we have a very difficult winter with a lot of cases, more people indoors, meaning more possible transmission. We don't have, it's very hard to contain this thing. That we'll be in a place of having to close some things down, and that the public discourse may get very difficult again. So I'm concerned about that, but I really appreciate the support of folks here in Alameda County for what we're trying to do.
Can I just, I'm Don, go ahead, you're back. Okay.
Yeah, I lost my internet. So that was exciting. So I'm on a hotspot. I'm on a hotspot now.
Oh, cool.
So,
good.
yeah.
Welcome back.
I'm going to be an expert in technology when this is all over with, for sure. Okay, so we have a question on testing, Dr. Moss.
Yeah.
Should residents get tested even if they have no symptoms or no known exposure to COVID? And does the data from widespread testing at public sites such as the fairgrounds help shape the health department's orders? This is a multiple question.
Sure.
And if yes, are there enough testing supplies to conduct the widespread testing, even if it is only for a point in time? Or should testing only be done to confirm if someone has COVID?
Okay, so a lot in there. I'm going to do my best, and we can circle back to some parts of the question. So we have, the county has put out a prioritization for testing, which is really just a guideline. It's not binding, and it very much mirrors what the state of California has put out as well, with some differences. And so we absolutely want hospitalized persons, people, in outbreak settings to be able to get tested. Those are very high priorities. And then below that, people who have symptoms, we want them tested because we want to know if it's COVID, and that testing process triggers a response from the health department. We can help find contacts and make sure they're staying home, that kind of thing. So those are very high priorities. We want to make sure that people who work in some of these fields where there's risk of exposure, healthcare workers, people who staff these congregate settings, even restaurant workers, things like that, for working in these businesses where they transit workers where they encounter a lot of people, we do want to make sure they have as much access to testing as they need. Teachers soon enough, right? For any in-class learning and other school staff. So we want to make sure that those people have access to testing. And then if you're exposed, you're a close contact to a case. This is a little bit more nuanced. In general, I would like to test everybody who's exposed. The best time frame for that's not clear, probably around 5 to 7 days. But here's the thing, if that test is negative, you still have to stay in quarantine for 14 days. So it's a little confusing for members of the public to interpret what to make of that. People who have symptoms, though, if they were a close contact, definitely a priority for testing. So that's like not a simple answer, right? It's all these different tiers and things like that. Another way to think about it is if you don't have any exposures, you've been working at home, you've just been hanging out with your household, nobody's sick, you're not sick, I don't think it's as important that you go out and get a test. We want testing to be accessible, particularly for people who live in those community, those hotspots. You can see those on the maps that we post on our website. But in general, I think, the testing is less important in that situation. It can be difficult to interpret with somebody who has no exposures and no symptoms, particularly if they get one of these other types of tests, an antibody test or an antigen test, not the main PCR molecular test that we use. So, I think it's a lower priority for folks like that. In terms of data from testing sites, so when we have it, we do use it to try to get a sense if things look different in different parts of the county. If we have enough testing resources directed to a part of the county. We don't make our policy decisions, our county healthcare policy decisions region by region. So it's not so much about our shelter in place orders or what's open and what's closed. Very difficult to do that. I think it's difficult to do it at a county level. As you've heard, we've tried to be in alignment regionally as much as possible. But in terms of where we direct testing resources, I think that information is very helpful. I don't know the fairgrounds data off the top of my head. I haven't seen it recently. I don't know the the positivity rate, and it varies depending on who actually shows up to test there. So it doesn't necessarily tell you who in the Tri-Valley has COVID or what the rates are. It just tells you something about the people who showed up to test at that testing site. So, keep that in mind as well. And then I think there was maybe one more aspect to that question that I lost track of.
I think you've covered it. You've covered it. And I think this is important because we have already started to receive calls from businesses that have been directly affected, and they want to know, an employee has tested positive. They don't say if they have symptoms. What do we do? Yeah. Test everyone. We just send them to your website.
Yeah, and actually they can email COVID Workplace, COVID Workplace, spelled like it sounds, no spaces, COVID Workplace at acgov.org, and get our standard guidelines, and they'll be asked to tell us how many people are impacted in their workplace. If it's just one person, have that person stay home. Make sure you're keeping track of who's absent. People who are sick are staying home, and it's really our case investigation contact tracing team's job to investigate that case. But if it's more people, then we may do more to support that workplace to make sure things are handled appropriately. But anytime there's a case, go ahead, email COVID Workplace at acgov.org, and we will help.
Okay, very good.
Okay, so the next.
Go ahead.
The next question is an application for a waiver to reopen a mineral and gem club workshop. They've found tons of documents to help them, but no process to submit a request for review.
Yeah, there's no process for any sector or business to submit applications to open early or anything like that. Our system doesn't really work that way. It's come up for schools. We're not accepting waivers for schools currently. We haven't set that up. We probably will do something along those lines for schools. The time frame is a little bit up in the air, but that's really the only situation that I can think of where we've sort of plan to have a system to look at waivers. It's really sector by sector. And I know that is not a great way to do this, because it kind of creates these winners and losers. This business can open, this one has to stay closed. And believe me, this is an issue known all the way up at the state. The state kind of set us on this pathway with their reopening plans early on, where it was business sector by business sector. We're looking at Santa Clara's model and also San Mateo County, where it's kind of more risk-based. So it's if you can do X, Y, and Z in your space, you can operate, and it's not so much what's on your license. We don't have that set up here yet. Making those changes is complex, and will still be bound by the state rules that are business by business. But that is something we want to move to, so that might help. In-store retail is open. I don't know if that meets the needs of this particular questioner, but there isn't a process to sort of say this type of you send an application to the health officer and we approve you to open up. But that doesn't really, that's not how things work.
So if they can figure out if they're a retail establishment, they can confidently open.
That's right. And there's some other things in there in the orders. I encourage people to read them. And if they want technical assistance in interpreting these things, they can email covidrecovery@acgov.org. Again, spelled like it sounds, all together, no spaces, covidrecovery@acgov.org, and ask, hey, I'm this kind of business. I want to operate like this. Is this allowed? And that team will do their best to give you an interpretation. So I hope that's helpful.
Okay, that might answer our next question, which was some small offices opening with just a few employees.
Well, okay, so currently, and this I believe is a state order, non-essential office spaces should be closed. People need to work from home as much as possible. If you, you can have, there's some ability to have sort of a minimum basic staffing to maintain a, a business that would, that needs that. But in general, office work should be done remotely to the greatest extent possible. That's the state order. And so I really encourage offices to find ways, we're all doing it, find ways to get those people working from home. There is some leeway with minimum basic operations. And then if you're an essential business, as defined in our order and in the state documents, and just because you're open doesn't mean you're an essential business, right? We've gone beyond, we kind of use the term loosely, but we've actually gone beyond essential businesses at this point. So if you're a true essential business, then and like government is a good example of this, you can get more people back in the office. But really businesses need to find ways to keep people at home as much as possible. When people are at the office, 6 feet of distance, face coverings unless they're in a private office, and then they just take them off when they're by themselves. And that's the general approach that we ask of businesses. They can email COVID recovery with those specific questions too.
Okay, great. Thank you.
My information overload is too much.
Well, yeah, but it gives us guidance. So related to that is when they do return to the office, what happens with these open space office environments?
Yeah. Listen, people group together in indoor spaces, that's where COVID spreads. So it's going to be physical distancing. It's going to be probably working below capacity for your space. It's going to be face coverings, and to the greatest extent possible, HVAC systems venting to the outside, or windows and doors open to get good air circulation in that space. I know that's can be challenging in some buildings, but to figure out how the HVAC works, get it venting to the outside so you're not just recirculating that air. And those are the basics. Distance, face coverings, few people indoors as possible.
I have a question that kind of follows up on that one, because some office buildings don't have doors and windows that open. And what about HEPA filters or things like that?
Yeah, and I'm less of, so yes, you can help out. So again, all those none of these things replace keeping the numbers low, face coverings, physical distance. But yeah, I think if you can't vent, I would talk to the building, see if how the HVAC system works and minimize recirculating air. But a HEPA filter is not a bad idea. Get one that's right for the space that you're in, right? A bigger room needs a bigger filter. Make sure it's the right type of filter. I think it's something like 16 MERV or something like that is the sort of appropriate minimum standard. I'm frozen. Can everybody hear me?
We can hear you.
Okay.
Yeah, but you're frozen. Yeah.
All right. Well, you're just
We lost him.
standard. I think it's
There he is.
16 MERV, I think is the standard, but don't ask me what MERV means. But there is some guidance I think CDC publishes about some of that air filtration, or maybe like NIOSH, National Occupational Health and Safety. You'll have to do some exploring to find the right filter for your space. But again, that's not a guarantee. So you got to really do these other things. Keep the numbers down, face coverings, distance.
Okay.
Can I follow up just on those questions about?
Can I just, Steve, sorry to interrupt. One thing before we switch to that. If you're going back into your building, and let's say it's been closed, it's your building, or everybody's planning to move back in at some point, and they haven't run the air conditioning system in a while, make sure you talk to the building management, let that air conditioner run for a bit, because there is actually an issue with what's called Legionnaire's disease, where water that's been sitting in that system for months because that building hasn't been open, bacteria can grow in there and it can get into the air system. And there's things that they can do, there's guidance for this as well, but it's mainly getting the system up and running and sort of flushed out for a day or two before people get in there. So That's just something to be aware of for those of you who are operating office buildings or in office buildings where things may not have been working for a few months.
Great, thank you. My follow-up question was a little further down here, but regarding the wine tasting, going back to that, you had mentioned that the orders may be changing soon. Do you have any best guesstimate when we may see that? That was a question that was asked, so I wanted to ask you that.
Well, I hate to put time frames on anything, but I would say, I'll say it like this: days to weeks, not weeks to months. How about that?
Okay. Thank you.
There's a quick follow-up on that the state has removed the bona fide meal requirement for outdoor wine tasting. The requirement does not improve safety. It simply adds complexity and expense. So I think that's along the same lines. So that'll probably fall within the same timeline.
I appreciate the feedback. I think we're in alignment, or we will be in alignment. Let me put it like that.
Okay.
Thank you.
But please, winery operators, keep those people from crowding together, because that's where the problems are going to happen, especially if they don't have face coverings on. Use your space, get them spread out. They really need to be in their household groups.
Okay, so from the fitness and wellness industry businesses, hopefully you haven't asked this while I was frozen and dealing with internet issues. So the indoor fitness facilities, of course, have been prohibited over the last 5 or so months, and they've moved to outdoor classes, but it's really just a Band-Aid. And so the burning question is any indications on when they think they can move those activities back indoors?
Yeah, fitness is a difficult one, and I understand this has been a real burden on the industry. I'm a gym goer myself. I've missed it. The problem with gyms, indoor workouts is high touch surfaces, people breathing hard, breathing out those droplets like singing or shouting, breathing hard, high respiratory rates in gym settings are very concerning. Even if you're doing, just weights and stuff like that, you're going to get your respiratory rate up. So it's a very concerning setting. Indoors is a much higher risk than outdoors. So you're talking about two things that add risk together there. I know that there are going to be things that individual businesses can do to protect their, people coming in. People often say, well, it hasn't been driving the epidemic in California. Well, that's because those businesses have been closed. So we haven't had lots of people in Alameda County or across the state in those kinds of settings. And I would be very concerned about them. And then another thing about those centers, I believe they're actually closed by state order in Alameda County. I can verify that, but I don't think indoor fitness is, even if I felt like it was safe, which at this time I don't, I think the state has said we can't open those. So I understand it's extremely challenging, and I will continue to, let me put it like this. It's my responsibility to keep looking for evidence and guidelines that we can point to say it's time to get people back into those indoor facilities safely. And I will do that, but we're not there. We're not going to be there for this next order, which is probably going to come out pretty soon.
Okay. So on that point, Dr. Moss, so many of these industries are being proactive in approaching the safety issue with, in this case, indoor fitness. So is the public health world listening to those experts to say, that might work. Let's give it a try. Can we pilot it? I mean, are you guys open to that sort of thing, or?
Well, I think so let me put it like this. This is true in a lot of other sectors. There's a lot of expert opinion. There's not always good data. Sometimes there is data, and when there is, that's very valuable. So When people who have COVID case rates like ours, and they open, fitness centers on a wide scale, and over time they're able to demonstrate safety, and that is not going to be an easy thing to do. I know some people have pointed to other states and said, see, it's safe here, it's safe there, but honestly, I actually don't think the quality of evidence is that strong to say that we can say they're safe at this time. And I think we also want to be consistent with what we're saying about indoor activities for other sectors where we've seen, evidence of transmission. So, really I need to be able to draw a difference for what's being done differently in fitness centers to preserve safety, especially in a setting where people are breathing a lot and putting those droplets into the air. Yeah, I mean, I'll look at all of those factors, but I think, having somebody, listen, scientific experts with opinions are a dime a dozen. What does the data tell us? Where is the evidence to say this is safe or not safe? And if we're going to start making decisions based on where we don't have data, we're just going to do it as cautiously as possible. We do have to do that. We have to open things without good data. But I can tell you, indoors with heavy respiratory rates, that's not the first thing we're going to open, especially coming out of our summer surge. And I know that's very difficult, but that's just where we are. In terms of piloting things, that's not really something that health departments do and have done with this. It's more like we'll make a decision to say, hey, these settings are safe enough that county residents can be in them doing their thing. And then we look to see what happens. And if there are cases, we would potentially have to shut them back down again. And I really want to avoid getting to a place where we're opening things up and shutting it back down. I don't think that's that great for our residents or businesses either. You are all obviously more experts in business than I am, but I'm glad that Alameda County's conservative approach has meant that when we've opened things, they've been able to stay open, as opposed to opening and then closing things back down. I know we had that weekend with outdoor dining. That's really the only example I can think of where we had to shut something down for a few days. And that was really due to state action.
Okay. And related to fitness, on swimming pools, lap pools, apparently the county health orders allows up to 12 kids to swim in a pool, but adult swimmers in a lap pool is not. And I don't know.
Yeah, so we're actually out of alignment with some of our youth summer camp, sports camp guidance. We're actually out of alignment with the state, which is a problem because they tie our funding to whether certain types of funding to whether we're in alignment with their orders. So that's actually a problem for us here locally. So what I'll say is that we want to get in alignment with the state guidance on youth sports and like camp activities, things like that. We're going to do our best to preserve outdoor youth activities that are safe as much as possible. And then what I'll say is probably going to be better news on the swimming front is we are looking to open outdoor public pools with some guidance. And that is something that's higher up on the priority list, just because we think it doesn't represent a huge risk as long as some steps are taken to protect the people coming into those spaces. So it may be that there'll be, even as we come into alignment with the state on some of their youth sports, there will be hopefully opening some spaces for swimming that there may be some, I don't want to call them workarounds, but opportunities to continue youth swimming safely with that. So look for more on pools in our next order, which again is days to weeks.
Okay, very good. Thank you.
Good. The next question's about personal services. And when is the county going to consider to reopen like the way outdoor dining reopened while indoor is still not allowed? Do you have a timeline on that you can share? Is it days or weeks or? Thank you.
Days to weeks, top of the list, right? That's a thing that we are looking to reopen. Outdoors, again, as you said, like dining, and I know that's not ideal for everyone. That's also a state order. So we're not, that's right now, that's not up to me to say you can do personal services indoor, but I don't think again, we're going to start with outdoor first. And I know that's not great for every business, but I also know, it's a first step.
Okay. Thank you. Inga, you want the next one or?
Well,
Sure. Where can someone sign up to receive press releases when they come out, such as an email distribution list or notification list? Do you have such a thing?
Boy, where can we sign up? I'll have to get back to you on where people can sign up. We do have some newsletters, and there are health alerts and things like that. Our website is the best place to look for information. There may be an opportunity to like put your name and email down. I just don't know it. My apologies, but we'll get back with the chambers to let them know what they can do.
Okay.
Dr. Moss, you had, I'm sorry to butt in, but somebody was asking too, you had another email, the first email you read off to ask questions about a specific industry. What was that email address again? Yeah,
and I'm sorry, there's two. So one is if you have cases at your business, particularly among employees, but if you're aware that there was a case in a customer, you can reach out as well. COVID workplace at acgov.org. That's if you have cases. If you have questions about opening your business or about the rules, that's COVID recovery at acgov.org. And don't worry, if you make a mistake, they'll probably figure it out.
And then also, I want to remind everyone that our chamber sends out our SIP, shelter in place notification. We send one out every single week, and my team is constantly monitoring the county and the state public health websites for breaking news. So we do try and push those out just in real time, Dr. Moss. So I think the chambers are working really hard to support that, getting that accurate information out for official sources.
Yeah, and then for you all to know, the chamber leadership and others in the Tri-Valley area, they do reach out to us at the health department to get good information to share with you all. So even if we're not always doing it, they are working on your behalf.
Mm-hmm. So I have a question here from a business, and this has more to do with equity and fairness on applying the rules and regs. And this is a go-kart indoor business in Livermore who has remained closed. It's not one of the, allowed businesses to reopen. No. And a similar business in a neighboring Tri-Valley community, which is, I guess, part of a larger chain, is up and operating in violation of the rules and regs.
They've been told to close, just so.
Yeah.
I didn't say Dublin, but it is in Dublin.
Yeah. Yeah. Local PD and also city managers can be very helpful in these areas if somebody's out of compliance. There's also a COVID compliance at acgov.org. The sheriff runs that. They try to triage those as best as possible. They get a lot in, but yeah, I'm really sorry that not every business is playing ball, so to speak, and it's enforcement is a complicated issue with COVID, but at the local level, there's a lot that can be done.
Okay, and that's COVID compliance at acgov.org.
That's right.
Okay.
Another email for everyone.
Another email. Okay.
Yeah, but also just working directly with the city is a good thing to do.
Just another follow-up question about events when we can actually have gatherings. Do you have a feeling, or can you tell some of our event facilities what will be the parameters of events? Will it be 50% of square footage? Will it be the number of people, or how are you envisioning that happening once we're able to do that?
Yeah, I mean, we haven't actually spent a lot of time on events besides these, places of worship, weddings, funerals, and vehicle gatherings. That's really what we've focused on. But I think my dog's going to start barking here in a second. So we don't really have, that's really not an area that we prioritize for getting open because, outdoor crowds is like very concerning from a public health standpoint. If things continue to improve with these other priority areas for opening, things we've discussed, plus schools, we'll certainly be looking at what the best practice is for, other types of gatherings, and we'll have some lessons learned from weddings and funerals and places of worship that I think we're gonna look to in terms of making those decisions. But we've been focused on some of these other areas.
There was a comment and concern about hosting weddings for 25 people for a ceremony, then turning them away to just go downtown for restaurants, being a double standard. So, I know there are some other weddings that are going on without regulations, with backyard weddings and things like that.
Sure.
So there's a lot of concern for that.
Yeah, I mean, those would be violations of the health order. So I think it's one thing to say that we're being inconsistent, but I think if people are actually violating the order, that's not a consistency problem. I don't, we have a lot of tools and systems in place to work with restaurants, and we've now had several months working with the sector as a whole. I think, I'm sure, as I said before, individual wedding businesses that can set up to operate just like a restaurant would be fine, would be very safe. The question is, can we regulate that equitably across the whole industry? And, I think we felt it's always tricky. I mean, there was a time when we weren't allowing weddings at all, and we really wanted to work to support people to safely have wedding ceremonies. I don't think we're in a place where we feel confident in across the whole industry. And again, this is not to speak to an individual business, but across the whole industry, that we could regulate the face coverings and the crowding of people in all the different wedding settings. People having backyard weddings, unless it's just their household, that's a violation of the health orders. I also want to say, I think and I'll confirm this with our team, but I think that regulations around food and drink for weddings and ceremonies is actually from the state, not just Alameda County. So I'll confirm that, or if somebody on the call already knows, please speak up. But so even if I wanted to, again, I would probably be bound by a state order in that case.
Okay. We have a lot of questions here, so we need to get moving. Can you address why or where Livermore's numbers are increased versus Dublin and Pleasanton?
This maybe I'm not sure if this is looking at the totals by city or some of the zip code data. Those are two different places where you can see the numbers. I actually looked at the Livermore zip code data just yesterday, and some of the zip codes are very large, so it's tough to really divine what's kind of causing things. But I'll tell you what we know about COVID. First of all, people don't only stay in their zip code. Even with our shelter-in-place orders, people are going to other parts of the county, even across county lines, to work, to run errands that they have to run, to go for a walk outside, things like that. So people's lives, and therefore the epidemic, is not restricted to these boundaries. And that is often, that information is not captured when we just say the number of cases by city or the number of cases by zip code. And that's why our approaches tend to be more county level or regional or statewide, as opposed to drilling down on neighborhoods and zip codes, things like that. So I think whenever you see those numbers, you just have to keep that in the back of your mind. That doesn't mean that there's an epidemic just localized to that zip code. And then it really is where people are gathering. And so as more people have gone out and about and gathered more, you're going to see case rates associated with those activities. Cases, if you're talking about the zip code with Santa Rita Jail numbers for people who are cases whose address is the Santa Rita address will show up in that zip code. And so again, especially when you're talking about really small geographic areas, there's lots of things in the data that kind of make it, it means you have to interpret it with a bit of a grain of salt. But I'll say, man, anytime people are out and about and gathering, either because of work or despite the shelter-in-place orders, doing it, with friends and things like that, we see transmission and we see cases. And so I think that's part of the story for, and why it's happening in some zip codes rather than others probably has to do with density of households in those areas, because once it gets into a household, it tends to get everybody in that household. I'm sorry, I don't have a more specific answer.
Okay. I have some kind of related questions to education and special needs, but on the education front, community members are expressing interest in helping students and families navigate distance learning. Should all help and tutoring be done virtually? Under what conditions, if any, would it be safe to do tutoring in person?
Yeah, I mean, this is a very difficult area that we're actually working on now. In fact, I have a call with Berkeley because we try to stay in alignment with their local health jurisdiction later today. We talked to them yesterday. I've talked to the other health officers in the Bay Area, the state. Erica, my predecessor, a big champion of getting kids back into school, I know is working on this issue at the state level. The problem is that we are not open for in-class education, and it's very hard to start making rules that say it's okay for a group of kids to get together for a tutoring session or even a one-on-one session, but to say that education is closed, because you start to create rules that schools could look at and say, well, if it's tutoring is okay, why isn't in-class learning okay? And from a consistency standpoint, we want to find a way to create opportunities for those things that also doesn't just result in in-class education being open before we're ready. And I think there are solutions. We're just not quite sure how we're going to frame those. But we do want to create a pathway because, and it'd be broader than just tutoring, but some level of facilitated educational activities is probably going to need to happen. For example, not all kids can do distance learning. They don't have access to the equipment, right? And so how do we ensure that they can have that? And so we want to create pathways for that. But it's a complicated area, and we don't have all the rules and guidance quite ironed out yet. So I hope that answers the question. I am in favor of having some degree of tutoring or other in-person sessions as long as certain safety practices are followed. But we just don't quite have it worked out in a way that makes it clear why what is open and what is not.
Mm-hmm. Okay. Then we have some for the special needs individuals, adults, aside from protocols already in place for the community at large. Would you suggest any additional practices be put in place for programs or residential communities serving adults with developmental disabilities? And if groups of adults with these disabilities are able to gather together, what would be a recommended group size? Are pods or social bubbles suggested for this population?
Good question. I actually met with the Developmental Disabilities Council earlier this week. We have a person at the Alameda County Public Health, Benjamin Chen, who's really, sort of our liaison to that group, and is been pretty active in trying to kind of support COVID preparations. So right now we kind of default to our existing rules, right? Limit gatherings, 6 foot of distance, face coverings, all that. I know there are some unique needs in that population. We haven't developed separate shelter in place rules, although I think there are starting to be guidelines. I'm not a master of these guidelines. I know that the state Developmental Disabilities Office has collected some guidelines, and CDC also has some guidelines. I would refer people to those for now for sort of how to do things right, as long as it's within our existing shelter in place restrictions, but very much a work in progress, and dovetails a little bit with some of the schools discussions, making sure that we have systems in place for students with developmental delay. So good question. Right now, it's just the broader guidance in terms of gatherings and how people can get together. Organizations that support people with developmental disabilities, by and large, are considered essential. So they have to operate safely, but it's those organizations should be able to work with their clients.
Okay. And you said that the point person at in the department is Benjamin Chen. He's
Benjamin
the liaison.
Chen, Chen. Actually, I think his title, I might have his title for you right here. Network is a bit slow. Here we go. His title is Developmental Disabilities Coordinator at the Alameda County Public Health Department. And our website is, do we want another website? I know there's been a lot today. acphd.org/ddc.aspx. And you can probably just Google search it, Alameda County Public Health Developmental Disabilities. So Ben is the coordinator, and hopefully there's contact information there on that website.
Okay. And by the way, this is being recorded, folks, so you can always, we'll post it on our websites, and you can always refer back to it along with the questions in the Q&A as well. Inga, Steve, you want to take some of the other questions in the Q&A?
Sure. Yes, I think we should probably ask Mayor John Marchand's question. He's asking, because of the shortage of analytical and supply capacity, the turnaround time for testing notification can be up to 3 weeks, which defeats contact tracing. What can be done to increase the capacity and reduce the turnaround time?
Yeah, Mayor, I mean, that is absolutely the problem. What is the point of testing? You can't get the result back in 3 weeks. At that point, I just, if somebody has symptoms or exposure, I make decisions based on that, because that becomes useless information. We want to know at the county if people were infected, just to keep track of the numbers, but much less valuable. So I will say the good news is I think the county partnered test sites are much faster turnaround times. My understanding is more like 72 hours. Still could be better, but much, much better. Some of the state operated test sites are actually have amongst the slowest turnaround times. I've heard that Kaiser has had some slow turnaround times lately. They provide a lot of healthcare in the region, maybe 30 or 40%. I know that some of the big commercial labs have had problems. It's getting a little better, is my understanding, in particular at Quest. But obviously, it's a huge, huge central problem to the response that these turnaround times are so bad. Again, it's not. So what we can do is say, let's make sure that let's prioritize those people who have symptoms or who have exposures or work in those areas where they're likely to be exposed, to make sure they get testing, and ask employers to not require clearance testing for people to come back to work, which is not useful and gives confusing and not useful information, and uses up that resource. And also to really ask people who are no exposures, feeling well, to wait to get tested until things are a little bit better. But we actually don't have much control over those supply chains. We are contracting with testing providers now. We have an open competitive bidding process to get some additional testing resources here in the county right now. There's a lot of different dimensions to that process, but we are, and I believe part of that process is that they need to demonstrate relatively good turnaround times. And so, to the extent that we're putting our resources into something, we want to put them into lab providers that have good turnaround times. It could change because those supply chains are national supply chains, and they might have a good turnaround time now, and it could change later. But But we really do want to prioritize that for anything that we're putting county resources into.
I have a comment. My daughter just went back to college Tuesday, and Contra Costa County was offering a 21-day turnaround on the test to go back to Hawaii. And we were able to get her tested at the fairgrounds, and she received her tests in less than 48 hours. So Alameda County is doing a good job.
Thank you. I appreciate that and sharing, and I think we have managed to do okay.
Yeah, and that was done on Tuesday. So.
Yeah. But that doesn't work for everybody. You know, if you're a Kaiser, you want to go to Kaiser and you can't, you know, so I get that it's a bit of a patchwork still. And
our healthcare provider refused to give her a test.
So it's a national challenge right now. So we do ask medical providers, if somebody comes in with symptoms or calls them with symptoms, they should be put in isolation. You don't have to wait for the test result to come back. You feeling flu-like?
Oop, he froze.
Uh-oh.
Uh-oh.
Dr. Moss?
Oh,
The internet. We're at its mercy.
yes, we are.
Okay.
Well, we'll
Okay, come back in.
just a little point of topic, since we're waiting for him to click back on, is there was a request when new orders come out, can highlight it or redlined for easier
There he is.
of what the changes were. So that's just a point of a request that was asked.
Oh, with when the new orders come out. Yes, I will pass that on. We'll see if we can do that. I think it's a good question. We're going to try to clean up some other things in the orders too, and we'll try to do that for you.
Wait, Dr. Moss, we have a couple of comments or questions here. There's a theme here. Are there plans to have our reopening guidelines consistent with neighboring counties? Are you guys working together?
Yeah, we talk. Everybody is making decisions based on their individual, county circumstances, and we've kind of, once you get in the habit of that, it's a hard habit to break. But what we do talk and compare notes and make sure that we're in general alignment. Schools is a good example. Everybody, like San Francisco has one school district, and it's just they're going to do things differently. Marin is smaller, and they're a little bit ahead of us with planning. But in general, we're trying to do more or less the same things because the evidence supports doing more or less the same things. Mm-hmm. So that applies with reopening as well. But there are going to be, it's going to be a little bit of a patchwork, and I don't think we're going to be able to escape that. We do our best. We've learned this lesson the hard way that if you have restaurants open in Contra Costa and closed in Alameda County, that just confuses people and doesn't really provide for public health. So we want to try to avoid that as much as possible.
At least coordinate with our the counties immediately adjacent to us, Contra Costa, Santa Clara, maybe San Joaquin, I don't know. So just putting that out there. Yeah,
we do our best.
We have one that I think has lots of confusion. Is besides, it's kind of two-part or three-part. Besides running the HVAC, what other basic tips for reopening a business are there? And how much needs to be in place for monitoring employees? Does monitoring info need to be recorded and kept? How much consideration needs to be given to infrequent walk-ins to the office versus employees as far as availability of things like sanitizing gel? And does the office need a thorough cleaning to reopen? And how often after reopening does it need that thorough cleaning, or does it only when an employee is tested positive?
So great questions, many of which actually have answers that are shared, I think, on our website. But I encourage this person and anybody who wants answers to these to reach out to that COVID recovery at acgov.org, and they can point you to all of the right guidelines that speak to a lot of these questions. Some businesses are different, so just making sure that if it's depending on the business that they get the right guidelines for their business. The state has a lot of stuff as well. And so I think that's probably better than me trying to kind of rattle off answers. But there are answers to a lot of those questions out there. On cleaning in particular, if people haven't been in your space, you do not need to do any special cleaning. And I think many businesses have elected to be very cautious if somebody was sick in their space and do like a deep cleaning and all that. I think increasingly we're learning that it's much more about what's in the air when people are in the space together and much less about like what's in the carpet or on the desktop. And so, we still clean our high touch surfaces at the Alameda County Public Health Department, but I think a lot of basically routine cleaning is much more important than any of this kind of special cleaning, but there is guidance on that. So I would consult the guidance, and especially if there's, depending on your industry. And then, I would really say the big area of safety is how many people are in this space at the same time? Are they wearing face coverings? How close are they together? Much more important than anything else. I know there's a lot of other stuff in that question. I think just go to COVID or email that COVID recovery at acgov.org, and they can really help give you a whole packet of information for getting your business up and running again.
Okay, next business questions from our hotel community. Wanting to know about indoor business meetings without food service at hotel venues, keeping in mind social distancing and face covering protocols would be in place. When might they be able to take place?
Don't have an answer right now, and I appreciate the question. I know it's an important part of their businesses. Again, indoor gatherings, very concerning. I really am telling people not to even have in-person meetings. And I know that it's a business issue for those hotels, but for businesses themselves, really have remote meetings to the greatest extent possible, have conference calls, getting people in the same room together, even if done safely. I don't think it's worth the risk if you can possibly avoid it. I know sometimes you have to do it. In terms of hotels, we'll take a look at that, but again, it's not something that we've prioritized for reopening. And again, I think there are state guidance around this as well. That is, the state guidance is backed up, is part of their state health officer orders. And so we want to be in alignment with that anyways.
And I just want to thank you for joining us. I have to jump off for another call, but it was great to see you, and congratulations on your future son.
Thank you so much, Steve. I appreciate it.
Yeah, so thank you all. I'll see you guys later. I got to
Thanks, Steve.
Thank
See
you
you soon.
Bye-bye.
Yep.
Okay, a
Bye.
follow-up to Steve's question is there a hospitality industry work group at the county to engage with staff on a policy level? Will Alameda County work more closely with Contra Costa and Santa Clara in terms of consistent guidelines for hospitality?
Yeah, the health department doesn't have a hospitality specific work group. We do have some industry specific work groups in a very limited number of areas. And as you can imagine, there are a lot of industries in Alameda County. So the best resource is the workplace recovery team, COVID recovery at acgov.org. That is the place to turn for questions about hospitality stuff. And, we know that there are unique issues with each business community, and we do our best and, can be available maybe to have a meeting and things like that. But we don't have enough warm bodies to actually have separate work groups for each industry.
Okay. So Dr. Moss, on the personal services, which you said is days and weeks coming, does that also include facials and massage services?
Yeah, I believe with some restrictions, but I don't quote me on that. I want to just make sure I'm in alignment with what our team has queued up and what the state is saying is allowable, because it's easy for me to say personal services, but there's a lot of things in there. So it's not going to be everything. I'm pretty sure it's going to be outdoors, but I think some aspects of those, some activities within those broader categories, I believe, will be opened up.
like facials and massages?
Again,
Doesn't know.
let's confirm. But hopefully we'll have information. You know, we want to kind of, when we're good to go, even if the order is not out yet, we do want to, you know, share information about it so people can start to get ready. And so hopefully we'll have stuff to share sooner rather than later. I'm sorry I don't have like the list ready for this call. It would have been good, but we're not there yet.
But it's coming. Great.
Yes.
So we have a question about contact tracing. So if you hear about someone with COVID at a restaurant and you do the tracing, it's a customer, what should employers expect to be asked to do in this situation? Will that, as you trace where that person went and they've been to establishments, do you contact those establishments? How does that process work?
Typically not. I mean, first of all, we are not, you know, when we interview somebody, we have a limited amount of time, they have a limited amount of time, and we ask them specific questions. You know, we will try to get a sense of any settings that they were at where there were people gathered. So if they say, oh, I went to this restaurant, it was crowded and it was on this day, we'll make a note of that. But if it's just a one-off, unless there's something specific in that history, we won't necessarily contact the business. And I think you have to think of it this way. People often they've done a lot of things, and it's hard for us to point to say, oh, it was this restaurant and not that restaurant, or it was this, you know. And believe me, we would overwhelm you all with phone calls, and if we were following up on every single time somebody named a business. That's not really how it works. We do look for patterns though, and if we hear like, oh, there was an event or there were multiple cases associated with a specific business, then we might reach out. And then we also look to the businesses themselves to pass on to us if they become aware of things, particularly within staff, right? Because once a customer has been and gone, you know, it's not clear what the best public health action is. If there's any action that we can take that's going to help anything. In most cases, there's actually not, but particularly with restaurants. But with staff, it's a different story. Those people are coming back to work every day. And we want to make sure that the business is doing everything it can to keep them safe, protect customers, have all the procedures in place. So we do want to know if a business is aware of cases, certainly with customers, but particularly with staff, and we can provide some guidance in that situation. Investigations for outbreaks, we really need to know that there are multiple cases associated with a specific spot. And often if it's customers, you know, it's really more employee cases that we would get concerned about in terms of an outbreak, because our actions are directed at preventing ongoing spread. And I know there are businesses with repeat customers, but it's really makes more sense from a public health standpoint to focus on employees who we know are going to be there day in and day out.
Okay.
Okay.
And Kennison, go ahead, Inga.
Is yours follow up to the just recent one?
No.
Okay.
It has to do with PPE, but go ahead.
Okay. I'm asking how we have a member that wants to know how frequently is sanitizing necessary in commercial spaces, and differentiate between cleaning and sanitizing. How effective is electrostatic cleaning and UV cleaning?
You know, I don't think those things hurt. I don't know the data to say that how effective they are, but I will tell you, as I was saying earlier, the main thing is the number of people in the space. You know, where we get concerned about transmission risk is really the number of people in the space at the same time, and with, you know, in particular without face coverings and in close proximity. You know, probably just opening the doors and windows if you can and letting things air out is going to be as important as those other measures. I don't really have data to suggest that, like, if you have electrostatic cleaning, you're going to reduce your risk of an outbreak or a case in your facility by X%. I'm not sure if that data even exists. So we certainly support good cleaning practices. I think for details and details specific to specific industries, again, I would urge you to you know, contact our COVID recovery team, because the answer does differ depending on what type of business it is sometimes. And also, I think most of the guidelines are pretty conservative about cleaning, but in general, you know, I suspect we're going to soon get to a place where routine cleaning is the most important thing. Now, if you have an outbreak in your setting, then we might say, yeah, you need to go in and deep clean just to be on the safe side. But it's people being in the airspace at the same time that where this thing spreads. And, you know, the office sitting overnight empty, probably the virus is dead or gone, you know?
The next day.
Yeah.
It's good to know. I think some
Okay.
people are super cleaning and it might not be necessary.
It spreads through the air, but it spreads through the air when people are standing around talking.
So we have 4 minutes left. I think we have one more question here. Well, I think you've pretty much answered most of these, but there's an essential business that wants to know if the county will provide free PPE to essential businesses.
I think we still have a system for providing PPE to certain types of businesses, and it is at the County Emergency Medical Services website. I'm just trying to bring it up. They have a request system, and it does depend on the business how it's prioritized. And so I'm left-hand typing here and using my other screen. My wife she likes having lots of monitors, so I'm fortunate to have a few options here. Here we go. So ems.acgov.org, and there's looks like they're linking to, yeah, they have their own COVID website, and they have a resource requests link for PPE and medical supplies specific for COVID-19. So it's ems.acgov.org/COVID19.page. But you can just go to that ems.acgov.org website and look for the COVID links. And you will find it, and I recommend going to that if you need stuff, and they'll do their best.
Okay, super. So we have 2 minutes. I think any other burning questions here, Inga, that you see? I don't know if Eileen Ng is on the webinar, if she's out there, but you know, we do want to express appreciation for her support, and any of your folks that I've worked with have been very responsive. So thank you very much.
Eileen's been a lifesaver. Thank you for calling that out. She has been terrific. I don't know if she's on, but she really is doing a huge amount of work.
And I think if there's any unanswered questions here that are left hanging out there, or burning questions later, I know Eileen is a good go-to person for that. Inga, you have anything else before we wrap this?
Do we have Eileen's email we can put in the chat?
COVIDrecovery@acgov.org. She probably reads every single one, but I think she has some help now.
Okay, people, all those questions, that's where you go.
Okay, so we're right at 11. So Dr. Moss, thank you very much for being so generous with your time and you know, covering so very many questions. And we do appreciate the work that you do, and we do support you, because you know, the business community realizes that, you know, we cannot reopen until everyone is safe, and that they feel safe and are healthy, and that the indicators are key, and it was what's driving the decision. So, you know, our businesses do not want to be impacted by this and shut down, because that is even more impactful to us in a negative way. So hopefully you'll come back after your leave and after your new son has arrived.
Yeah, thank you so much for saying that, Dawn. And I agree, you know, getting the whole, you know, pandemic under control here in Alameda County is the most important thing for businesses. And I really appreciate all of your partnership. Thank you so much for having me.
Thank you. Congratulations.
Okay.
Thank you. Thank you so much.
Thank you, everyone. Okay.
Thank you, Dr. Moss.
Bye.